Hey everybody, we are going to get started with lab testing and procedures for lab testing. We're going to go over, today we're going to go over non-blood specimens. We may not finish it all, but there'll be some videos as well that um, we will watch as we go that just kind of show you how it's performed so you can actually see. So non-blood specimens, some of the most common non-blood specimens that we collect would be urine. We do random dipstick UA. Sometimes we do cultures. Sometimes we have a first morning urine, so they come in really early and we collect a first morning urine, or we do 24-hour urine. Those are common urine type specimens that would be done in any type facility. Um, we also do stool cultures for O&P, for a smear looking for white blood cells, things like that, or for guaic, which is also for occult blood, which means for traces of blood in the urine. We check emesis for pH and for occult blood as well. We do wound and skin cultures, and we collect sputum cultures or sputum specimens. So those are some of the things that we collect when we in the clinical setting that are not necessarily blood specimens. Most of the time when people think about labs being collected at the doctor's office, um, you automatically think about it just being labs or just being blood collection. But, there are things that we do when we collect saliva, we collect cultures off the back of a throat, we collect sputum. Like I said, there are other things that we do, and we're going to talk about those first. Then we'll talk about some of the blood testing. We'll talk about normal values, and you'll need to learn those normal values for the test that we discuss. And then we'll go into phlebotomy. You need to know what you're testing for before you learn how to actually draw blood. We're going to see some videos on how to collect urine, how to collect an in and out cath, how to collect a stool specimen, how to collect an emesis specimen, how to do a wound culture, how to do a sputum culture. We'll look at all of those kind of things so that you can see what it's supposed to look like. I think it's just important not only for me to talk about it, but for you to watch someone actually collecting it. When you come over and visit, we'll actually do some of these. I have some fake urine, fake blood, different things that we can utilize to do this. Okay. All right. So let's keep going. As a medical assistant, labs that you can do yourself that get results fairly quickly are CLIA-waived labs. So CLIA-waived labs are labs that the FDA has designated that there's a specific number of tests that can be done in an ambulatory care facility. And it's because they're not complex. They don't use a complex machinery. They're there to be that they're relatively simple to be completed. If a doctor's office does CLIA-waived testing, so say they collect rapid flu, they do flu swabs, though the doctor's office has to have been their facility has to have a certification saying that it's okay. Now, there are other places besides a doctor's office that do CLIA-waived lab testing. Those include places like home health agencies have CLIA-waived testing certifications, hospices, different places like that. They may also some physical therapy places, some places that have trainers, physical therapy, or they have sports trainers. They may also have CLIA-waived certifications there as well. So some examples of CLIA-waived tests that we're going to discuss: pregnancy test, rapid strep, rapid flu, urine dipstick, hemoglobin and hematocrit, blood glucose, which is a finger stick blood glucose, a finger stick hemoglobin A1C, cholesterol testing, H. pylori, which helps. It's a bacteria that helobacteria that can get into the stomach that could cause an ulcer. Monospot screening for mononucleosis. Drug testing. Now, this is not drug testing like drug testing for a job-related injury. CLIA-waived drug testing is literally maybe a lot of doctors now that prescribe opiates, so maybe they prescribe hydrocodone. They'll do random drug testing to make sure that there's not other drugs in their system. That kind of drug testing can be done CLIA waived, and it's relatively simple. They urinate in a cup, and there is some of them have a stick that go in them. Some of them you put the lid on and shake it, and it will tell you, or you put a card down in it, and it will tell you what it is positive for. So that kind of drug testing, fecal occult blood, which is FOB, fecal occult blood, which is testing to see if there's blood in the stool, or blood in the emesis to see if there's a GI bleed. Those are things that are fairly simple tests that can be done by a medical assistant, by a nurse, in a doctor's office, because there's not any complex equipment. Now, we'll talk about this a little later, but you do have to do control testing to make sure your equipment or what you're doing is being done properly and that it's calibrated appropriately. CLIA waive testing and quality control. So that's what we're going to talk about now. CLIA waive tests have there are different types, and there are different times that you have to do controls. And what a control is basically there's a solution that you would for a UA. There are machines that you take, you collect a urine specimen, you put the dipstick in it, and you put it on a little tray that comes out. It goes back into the machine, and it reads the urine dipstick for you instead of you having to read it. And we'll look in a minute when we talk about UAs. You'll see how a video on how they use the actual bottle from the dipstick to read a urine dip UA. There are also machines that will do that. Those have to be calibrated. Those actually have to be calibrated every day. And you actually put a control solution. One is positive, one is negative for a bacteria in the urine, and you run it, and it will tell you that it's running appropriately. Finger stick blood sugar. So when we stick someone's finger to check a blood sugar, we actually the FDA states we have to we have to do controls on those every time we use it. And it will have, you'll put a collection stick in, the glucometer, you will put the control solution. Sometimes they have them that have a high or a low or a normal. And when you use that solution, it should have a normal reading. It should be between 70 and 110. If it's high, it should actually tell you high on it. If it's low, it should read below 60. So it would give you a reading so that you could show that you collected it. A1C machines. So you collect a certain amount of blood from a finger stick. It goes into a little collection container that's about this big. It has just a few drops of blood. It clips on, and it's a machine that will run that A1C to give you an average blood sugar for 3 months. That machine has to have a solution that tests it every day to make sure. Hemoglobin hematocrit machines, depending on the machine itself, it may be weekly or monthly that control has to be done. But the important thing is that we do those controls to make sure our equipment in the facility is working appropriately. 2 reasons. 1, we want to make sure our patient is getting the accurate results, and so they can be treated appropriately by the physician. The other reason is every facility has a governing body. So it may be Department of Aging and Disability. It may be Department of Health. It may be Joint Commission. Those are differing agencies. It may be, is it DRL? DRL may be the other one. But those are agencies that come in and they review records. They review quality control. They review the cleanliness of the facility. They'll go look for things that are expired. They're actually doing an inspection of your facility. If those quality controls are not being done, or those controls are not being done based on the manufacturer's directions and based on industry standards, then what happens is they can do anything from a small fine and then come back and check you again later, all the way to actually closing your clinic down and fining your provider a substantial amount of money. So you want to make sure that this is done. They can take away the doctor's ability to do any kind of testing. Those are all things that can happen. So it's really important that quality controls are done based on industry standards and based on the manufacturer's directions. And also based on your policy and procedure. policy in the policy in your facility, it can't be less than industry standard or manufacturer recommendation, but it can be more. So maybe your machine says that you only have to check it monthly, but your policy is that you do it weekly or that you do it daily. So be sure that you know the policy related to quality control for your specific facility, because it may be different than the manufacturer, or it may be different from one place to another that you work. So be sure that you're aware of that. It's very important, because if you're supposed to have done the control that day and you didn't do it, and I'm coming in just to do my checks, to my quality checks on you, then I'm going to have to write you up because you didn't do what you were required to do. So just be sure that you're doing your controls, and it saves everybody time and money in the end. So we're going to talk about different kinds of specimens. And we're going to discuss some of the normal U.S. standards and the manufacturer. Just be sure, like I said before, every time you collect a specimen, if you have not done it before, you have not read the directions, that you do that you go back and you read the directions. If it's the first time that you're doing a test, so maybe it's the first time you're actually doing a real flu swab, you want to make sure not only that you read the directions, but that you talked to someone or you had someone watch you do that. It's always okay to tell a patient, I'm new to the facility and I'm just double checking myself. I want someone to watch me do this procedure because it's the first time I've done it here. You don't have to say it's the first time you've ever done it. It's just the first time you've completed that task at that facility. No patient will ever mind that or think less of you, I promise. They actually think more of you because you're making sure what you're doing to them, you're doing it correctly. So we're going to talk about some examples now. A clean catch UA. So a clean catch UA is basically how most doctor's offices collect adult urine. When you do that, there are some specific steps, and you need to know these steps. There's some specific steps that you do to be sure that the urine that's collected does not have normal flora. Normal flora means normal bacteria for your body. So everybody has certain bacteria that grows on their body no matter what. It's there to help other bacteria not grow. So you want to make sure that that you get a good, clean specimen. And there are specific ways to do that so that the specimen itself is intact. There's also some ways that to be sure that all specimens are labeled so they don't get confused. So let me go down. Let me talk to you about what you do. So if you have, and males and females are similar but a little bit different. So the first thing that you do is you want to collect all of the things you need for your patient and for you to collect any specimen, no matter what it is. So for a urine specimen, you're going to get a sterile cup or a sterile container that has a lid. It'll have a little seal on the side. I always chose to label it first. Some facilities will print off just a sticker label that will have the patient's name, date of birth. It'll have the doctor's name, and it'll print off what the test is. You're always going to initial date and time, any specimen. So just remember, and you'll need to know this, all specimens should contain the patient's first and last name, their date of birth, the time of collection, the location of the collection. So, and not so much on urine, but they'll need to know it's a clean catch, or the type of, they need to know if it's a clean catch. A lot of places you just put clean catch, or you put catheter, or you put sterile. And then you would put your initials and the date and the time of collection. Those are all very, very important because that way it doesn't get mixed up. The results go to the right place. If you just put a urine specimen and put someone's last name on it and today's date and not the doctor, there may be 15 Smiths that go to that. There may have been 5 Smiths that had an appointment today and all had a urine specimen that needed to be collected. So just be sure that you put all of the correct information on there. And sometimes people have the same first and last name, so you have to be sure you do that. So let's talk about how you collect it. So you're going to get that sterile specimen container. And you're going to make sure that it is sealed on the side. You're going to get a peri wipe, and that's what it's called. It's called a peri wipe, and it is just a wipe to help clean either the vaginal area or the meatus of the penis, so that any bacteria or any debris or anything that might be present is cleaned off. You're going to collect you're going to have a pair of gloves, and you're going to have a biohazard bag. And the biohazard bag, you want the patient to go ahead and put the urine specimen in the biohazard bag. The gloves are for you so that you don't get urine on your hand. You want to tell the patient when they go into the bathroom to wash their hands. First thing they need to do is wash their hands. For a male, they are going to wipe the meatus, or the opening of the penis. They're going to wipe from the opening of the penis out around the glands of the penis so that it is good and clean. And then they are going to urinate just a little bit, stop urination, and then they're going to collect the rest of that urine in that sterile container. They're going to put the lid on it. They're going to put it in that biohazard container, and they're going to bring that back to you. If you're going to do a urine dipstick on it, and just a one where you're going to read it yourself, you're going to put your gloves on. You're going to take that specimen out of the biohazard container. You're going to put the urine dipstick in for depending on which urine dipstick you're using and which manufacturer. It may be to put it in there for 30 seconds. It may be a minute. It may be 2 minutes. Then you're going to set it out on a paper towel for X amount of time, whatever the manufacturer recommendation is. And then you're going to read it using the bottle, or if you're going to use the UA machine, you would have taken that urine, set it down on a towel for just about 30 seconds, paper towel, and then you're going to put it in the machine and let the machine read it. So that's for a male. For a female, it's similar, but when we're going to collect the same equipment, but what we tell a female is to take the peri wipe, and they are going to wipe front to back and drop it into the toilet. They're flushable wipes. Then we are going to tell them to urinate just a little bit, hold it, open the container, put the urine specimen cup near the meatus, or the urethral opening, and then collect the remainder of their urine. We do that because that peri wipe cleans off and helps make sure that no normal flora gets into that specimen collection. We want it to be a good clean catch. That's a clean catch. That's how we would do a clean catch urine. Other types of urine collection that we might do would be like a 24-hour urine collection. And what happens and the reason why we do that, there are things that we need to be looking for, like heavy metals, total proteins, creatinine clearance. If we have a patient that's coming in for a creatinine clearance, we want to be sure that we remember, if they've done that 24-hour urine with that creatinine clearance, when they come in, we have to send them to the lab. They can't just drop the urine off and leave. We also have to send them to the lab for blood work. They have to have their blood collected along with at the time that they turn that urine in, so that the ratio can be done and the specimen can be completed. Now, 24-hour urines are not CLIA waived. They are a send out to a reference lab. Now, let me explain to you what a reference lab is. A reference lab is a place that when you work in a doctor's office, unless you work in a hospital, most doctor's offices or most small facilities will have someone that comes and picks up blood, urine, wound cultures, stool specimens, and they take them to another location for the labs to be ran. A couple of those companies, DRL, LabCorp, Quest, those are the three most common labs. DRL, LabCorp, and Quest. Those are the most common. And you use whatever reference lab that the patient's insurance is contracted with. Teachers, we're contracted with Quest. Most places are contracted with LabCorp. Some places are contracted with DRL. But what happens is they go out and they run those more complex specimens, and you get the information back in anywhere from 1 to 5 days, depending on what the specimen is. If you do a CBC, which is a complete blood count, you'll get that back the next day, sometimes the same day. If it's a UA with a urine, if it's a urine culture, in 24 hours you'll get a preliminary. In 48 hours you'll get the actual bacteria, and sometimes in 48 to 72 hours it'll tell you what medication or the sensitivity, what medicine that can be prescribed for that. So reference labs are for more complex procedures that we can't do in the office. So I wanted you to understand when I say reference lab, what I mean by reference lab. 24-hour urines always are a reference lab. It is not something we can do in the facility. We just can't. So that has to be sent out. So I'm going to talk a little bit about 24-hour urine and how to collect any 24-hour urine. Now, one thing I will tell you, the containers that you use are different. So you need to be sure when you go to if you're getting these from your reference lab. So you're telling your reference lab, I need containers for heavy metal, a 24-hour urine for heavy metals, total protein, creatinine clearance. You need to make sure they send you the correct container because some of them have a coating on the inside. You want to be sure that the patient understands that they have to collect all of their urine for a 24-hour period. And you're going to give them the materials that they need. You have to give them, like I said, make sure you give them the correct container. They're 1 liter containers usually. They're a yellow kind of color. They have a little handle on them, a white lid, and they're usually a 1 liter container. You will usually give someone 2 to 3 containers. And the reason why it's 2 to 3, if someone's on a fluid pill or a diuretic, sometimes they urinate more than someone not. So you want to give them 2 or 3 containers, and then you want to give them 1 to 2 large biohazard bags because the urine has to be refrigerated. What you want to tell them when they're collecting that 24-hour urine, they're going to be at your office at 3 in the afternoon, and you're going to tell them, okay, when you get up in the morning, you're going to start this after your first morning urine. So you're going to go ahead when you wake up, go to the bathroom, and then all the urine you collect after that, every time you urinate the rest of the day, you're going to collect it, and you're going to in the Speci hat, which is this little white large container that sits into the toilet, and it will collect, and they can pee in that, and then they can pour the urine into the container. Now, it can't get stool in it. If you get stool in it, you have to throw it away. It just won't work, and you have to kind of start over. The other thing you have to tell them is that they have to keep it refrigerated. So that's where that biohazard container comes in handy. You want them to be sure, and be sure you give them that specimen hat to collect the urine in. But you want them to put that container every time they urinate. You want them to take it out of the refrigerator, put the new urine in, put the lid back on, close that container, and put it back in their refrigerator. A lot of people have a little bit of issue with this, but that's why you have that biohazard container. The urine needs to be refrigerated until they are ready to return it to you. And then you're going to take it and put it in your refrigerator until the reference lab picks it up. So it has to stay refrigerated. And when you put it out for the reference lab, you're going to put cold packs in there for that as well. So you're going to have to keep it cold. Other things you have to remember related to a 24-hour urine is if there is another test that goes along with it. So if you want them to write on the bottle, if they had their first morning urine at 7:30 and they urinated again at 9 o'clock, you want them to write on the bottle 9 a.m. Start time, 9 a.m. You can put a sticker on it. You can do whatever you need for them that tells them to put the start time, and then when they did their final urine. Now, they didn't give you your first morning urine when they woke up the first morning, but they are going to collect urine from after their first morning urine, and then the next morning they will collect that first morning urine. So that's when they would stop. And then it may be from 7:30 or maybe from 9 a.m. to 7:30 a.m. the following morning, but you want them to put the time they started till the time they stop. There are some specimens that it doesn't matter. They just need 24 hours worth. You will always be able to look in your reference book for your reference lab. There'll be a book that tells you the lab test number to put on the requisition, what kind of containers that you need, and all the information related to that test. There'll always be a book or an online source to help you be able to collect that and do it correctly. If you don't do it correctly, you have wasted your time, the patient's time, because they'll have to do it again. So if they're doing a 24-hour 24-hour creatinine clearance and you don't send them to the lab to get the blood work, they have to start over again. The blood work has to be completed within so many hours of the urine being dropped off. So it has to be done that same day. So be sure that when you do that, you do it correctly. Let me look and see how much time I have taken up with you guys. So we're at about 25 minutes. I want to make sure I give you time to, I want to make sure I give you guys time to do some reading today as well. So let me, okay, so we're going to talk about catheterization for urinalysis and urine culture. This is a sterile procedure. We are going to practice sterile procedure. You're going to learn about sterile procedure when we talk about infection control. But what you're going to, a sterile specimen collection tray is all put together for an in and out urine cath. For an adult, it's usually with a 14 French rubber catheter. With for a PD, it's usually a 10 French catheter. And for an infant, there's a specific infant collection set. It has a 7 French catheter, and it has a collection tube already on it. And then you basically just close that container and send it off for testing. For adults and children, larger children, you collect it in a sterile container, and then you put that into you put that in a collection cup, and then you go ahead and label it and get it ready to go. Sterile procedure must be adhered to at all times when you do this type of collection. You don't want your body flora getting in and contaminating that specimen. A urine dip may be done, like you may be doing the UA, and then we're sending the urine off for culture. If so, you have to collect the urine culture first. So you have to take the urine and you need to put it in whatever kind of specimen container the reference lab says. So if the reference lab says it wants 10 cc's of urine transferred into a specific tube and then shaken until the diluent or the powder inside that tube is dissolved and then it's refrigerated, that's what you do. You do not put the urine dipstick in until the culture process has been completed. So that sterile field is maintained so that you're not putting something, because when you put your finger in to get a urine dipstick out, you're introducing bacteria to the end of those urine dipsticks. And if you put that into that urine specimen, then you have contaminated that urine specimen. So you got to be sure that when you do collect a sterile urine for a UA and a culture, you get the culture set up first. You may have to draw some urine out with a sterile needle and syringe and transfer that to do your urine dipstick. It just depends on what your reference lab wants. Now, like I said before, in about 24 to 48 hours, you'll get an initial result. In about 48 to 72 hours, you'll get the final result, which has the actual bacteria and what will treat it, the culture and the sensitivity, what it's sensitive to and what it's resistant to, what kind of antibiotics. You get that back in about 72 hours, 48 to 72 hours, depending on your reference lab. So I want to show you these videos, and then we are going to stop for the day so that you can have some time to do your reading. Remember, you have today and tomorrow to get that read, and you'll have a quiz over the reading tomorrow. So the first thing we're going to look at is a male. It is a male catheterization, and it's performed on a mannequin, not a live human, but it is the steps for completing a in and out cath on a male specimen. We'll look at how to do just a normal urinalysis as well, and then we're going to do an adult female. But we're going to watch this one first. It takes just a minute. I'm sorry. It's a little slow.
Today we're going to review the process of a sterile INO catheterization of a male. We're going to go from the very beginning to introducing yourself to the patient, going through the procedure and maintaining a sterile field, and then finishing up.
Sorry, guys. I was trying to make it bigger, and it's giving me a fit, so we'll just leave as is.
Today we're going to review the process of a sterile INO catheterization of a male. We're going to go from the very beginning to introducing yourself to the patient, going through the procedure and maintaining a sterile field, and then finishing at the end. Good morning, Mr. Harris. My name is Bryce.
Good morning.
And I'm going to be your CNA today.
Nice to meet you, Bryce.
You too. Okay, the doctor has ordered a procedure called straight cathing. What it is, we're going to temporarily insert a catheter and drain the urine from your bladder that you're unable to. It is, we will not be leaving it in, it's just an in and out procedure. Okay? Okay, can I ask you to please verify your full name and full social for me?
Mike Harris, 519-34-9876.
Okay, very good. I'm going to wash my hand and gather supplies and we'll get started, okay?
Okay.
All right. Thank
Now,
you.
I will tell you guys, we do not. I will tell you guys,
supplies.
we do not ask Social Security number. We may ask date of birth or some other information. I think this is a military training video, so in the military they would ask them their Social Security number.
Authorization kit. I've got my catheter. I also have a pair of sterile gloves. They are. I need larger, so that's why I brought them separate because I can't use the ones that are in the tray. So we're going to set these to the side right now, and we're going to open up our kit, maintaining a sterile field. Okay, Mr. Harris, I'm going to have to roll down the blankets.
Okay.
Okay, I'm going to have to lift your gown up, and I'm going to have.
Now, this is not Mr. Harris. You are just hearing his voice. This is actually a mannequin. So just be sure you understand this is just a mannequin. You are going to see a mannequin male penis. Please understand that this is just part of what we do as healthcare professionals.
Ask you to keep your legs spread just like that, the way you have them for me, okay?
All right.
Okay, I'm now going to open up my catheterization kit. Place that down there. Dispose of a piece of paper on top. Grabbing only the ends.
Now, you will see here how he maintains his sterile field. He does have on gloves. Those gloves are not sterile, but if you watch the way he opens it, he is very careful to open it to maintain his sterile field at all time. We will practice this sterile technique as well.
Open up my catheter kit. Okay, I'm now going to place my drape with the shiny side down. I'm going to remove these gloves because I'm not going to need them because they don't fit me, and I brought some larger ones for me. Okay, I'm going to now place the second die cut drape.
Now, as you can see, when he's doing this, when he is touching things with his non-sterile gloves, he's only touching what he needs that would not be sterile anyway, which would be the drapes, the covers, and those kind of things.
Around the penis. Okay, I'm now going to open up my catheter package a little bit, and grasping the catheter right here, I'm going to peel back the rest of the packaging. Open it up. And dropping it into the sterile field. Now I'm going to remove my gloves so that I can put on my sterile gloves. Okay, I'm now going to open up my sterile gloves.
One more thing I want to say. As you can see, he has got his badge in his pocket. He has done that so that that badge does not fall in his sterile field. We would do the same thing with long hair or anything that could dangle down into that sterile field. We would keep it pulled up, pulled away, tucked away, removed, so that It doesn't get in the sterile field. If you have a loose watch, anything that could get into that area, you would remove.
And so I don't contaminate my field, I'm going to actually step around, open the package up, stay open, touching the only the folded part. I'm going to put on my left-hand glove first. Cuffing under, I'm going to pick up a rag glove, inserting 3 fingers at least in. Okay. Now coming over to my tray, I'm going to remove the packet. I'm also going to remove the contents I do not need. Specimen cup, lid, and the syringe if it was a Foley. I'm going to open up my lubricant. Put it in the space on the tray. Open up my iodine. And saturate the cotton balls with it.
Some of these come with swabs as opposed to cotton balls that are pre-treated with the Providine or
I'm going to
iodine.
place the tray under the penis. If the patient has foreskin, I'm going to retract the foreskin. I'm going to take tweezers and grab a cotton ball. I'm going to get a cotton ball and holding the penis at a 90-degree angle. I'm going to start from the center, move to the outside. First cotton ball. I'm going to repeat the process again with the second cotton ball. And finally with the third cotton ball. I'm now going to take my catheter and lubricate the end. Careful to hold it up, not contaminating it. Just twirl it in the lubricant. Holding the penis at a 90-degree angle. I'm going to slowly insert the catheter. Mr. Harris, I would like you to just breathe deeply and slowly for me.
Okay.
Okay. Gently inserting the catheter. 6 to 8 inches or until flow starts. Draining the urine into the basin. Once the flow stops.
Now he's just draining the bladder. If you were collecting a urine specimen, he would have kept the sterile container and he would have collected the urine in that container, and then the remainder of the urine from the bladder would have gone into that particular container.
Gently retract the Foley a little bit so that you can empty the bottom of the bladder. When that stops, gently remove the catheter. Document your results after you have replaced the foreskin to prevent compromised circulation or painful swelling. Clean the patient up and then properly document your results.
Okay, so that was from the VA clinic, but you see what it takes to do that catheterization. We will do the female. We will pick up tomorrow catheterization. Okay. All right, everyone, have a good day. I will be back with you tomorrow. Be sure you're doing your reading. You will have a quiz over the reading and some of the video material as well. Okay. All right. Have a good day, everybody. Thank you so much.